Welcome to the University of Colorado School of Medicine's Ask an Expert with Dr. Rosemary Rochford.
I'm a professor in the immunology and microbiology department here on campus, and I also have a adjunct appointment over in environmental occupational health in the School of Public Health. And I do research primarily on Epstein-Barr virus and malaria, and work overseas in Kenya and Uganda. So I have more of a field-based research and also have a lab-based research program. So a little bit of a virologist, a little immunology, and a little epidemiology.
Why does COVID-19 seem to be less severe in children?
Yes, and question, and the answer we don't know. So that's the short answer. I have no idea, nor does anybody else. But I would just remind everybody that we do know that many viral infections are different between kids and adults. So the outcomes are this is not unusual to see a difference. For example, EBV, the virus I study, if kids get it in the infancy, it's asymptomatic. But if they get it as teenagers, it's linked to infectious mononucleosis. We can think about mumps. Again, asymptomatic in children. You get it in young adulthood, and it's going to cause a much more severe disease. So there's a lot of examples of viral infections that are different when young kids get them versus adults. So that's we actually don't know why that is the case. Even with EBV, we've been studying it for years. We don't know why. Well, we have some ideas, but still not a definitive answer. So I think with this one, what's interesting is that typically in respiratory viral infections, you see sort of the very young get very seriously ill, like with flu, RSV, the very infants are very seriously ill. And then you can also look at the elderly population getting ill. This one looks like the very young aren't getting ill, but the elderly are. And so obviously there's a striking difference. But why that is I think, going to be a lot of people around the world are asking that very question and trying to get at that answer.
What causes the difference in severity?
One of the things that you're seeing with the COVID-19 patients, not just in the elderly, but in adults, is acute respiratory distress syndrome. So an overreactive immune response. So it could be that something is triggering that memory of something else. So you could be getting a sort of an aberrant response because you think you're fighting off a bad pathogen when in fact, well, you are fighting off a bad pathogen, but it's like your immune system is not behaving the way it's supposed to. And whatever is the adults have the memory of, the kids have never seen it, so their immune system is not responding. I mean, that could be one thing. It could also be just differences. We know that we think about our immune system when you're born is like, here it is. But we know that for example, infant immunity takes a long time to develop, right? So even after you're born in the first year of life, your T cells don't make interferon gamma. So there are differences that we think in terms of cytokine responses that might be different.
What about cross-reactivity with other viruses?
Great question. So is there cross-reactivity? And that with other viruses or other pathogens, perhaps. So that might be that's why I have come up with this phrase, and I don't know if it's the right one, but I keep on thinking about it. It's like PTSD of the immune system, right? That it's responding in a cross-reactive way, in an appropriate way, right? To cause that sort of cytokine storm, if that's exactly what it is. We don't exactly know if it's just IL-6 or a whole range of cytokines, which is what you typically think of with a cytokine storm. So, but something is triggering it in a way that kids don't see, and that tells us it's an exposure at some point, right? But whether it's a virus or other kind of pathogen or something else, we don't know.
What about immunosuppression, which mimics a child's immune response?
Yeah, I mean, that would be the key, is to say, why aren't they responding, right? So what are they not making? And why aren't they making it versus the adults? And you could basically suppress it in the adults, would be the key. But until you know exactly what that difference is, if it's memory, then it's going to be a tough one to erase that memory response. So that's going to be a tricky one.